Good morning. Good morning. This is Dez Wilson. This is Black with COVID, and we'll get started here in just a minute. Hey, good morning. This is Dez Wilson. This is my talk show, Black with COVID, on Rec and South. I have a very special guest today. This is the new editor-in-chief of Rec and South, Mr. Ryan Nave. How are you doing this morning?
What's going on, Dez?
Yeah, I'm pretty good, man. So just a brief summary about Ryan. Ryan is the newest addition to the Wrecking team. He's formerly editor of Mississippi Today. Ryan's an extremely talented journalist, a lot of experience in his field. We're definitely glad to have him on the team and to have him leading this new ship of what we're creating with Wrecking. In addition to this platform, we also have several others. And, you know, Ryan, in addition, we'll get into the kind of COVID talk, but I wanted the viewers, you know, if you could also kind of give just a general synopsis of what Wrecking is and the direction that we're headed with what we're creating.
Yeah, thanks, Dez. So I joined Wrecking in early May, and the thing that I was really excited about was the fact that you know, in an area where newsrooms are contracting, resources are leaving newsrooms, nobody's starting new news organizations. Right, or very few people are starting new news organizations. There are some notable examples of people who are really doing really cool stuff. But this is an opportunity to create a whole new thing in the news space. For folks who aren't familiar, Wrecking is a Southern news brand. For younger folks, I mean, however you want to define that. You know, I know some of the labels that we tend to throw around, millennials and Gen Xers, get kind of muddled. But, you know, it's for, you know, people who are young at heart, who are very intensely passionate about the issues affecting their lives and their communities. And so, you know, we want to use Wrecking as a space to not just write about things, not just to cover stories, but also really help our core audiences, you know, figure stuff out, right? So we want to equip people with tools and resources, you know, in some cases, like actual physical worksheets that, like, if you want to know how to get engaged around a particular policy issue or legislation, you know, here are the people to go to, and like, here are some tangible steps you can take. We're based in Alabama, but Wrecking's work is regional. So we're all across the South, but that's not limited to the geographic South, because, you know, we know that the South lives large in the American imagination. You think about folks who are part of the Great Migration story, for example, and the whole thing of like, folks up north sending their kids back south to you know, grandmama and granddaddy house for the summer. And so, you know, the South is the genesis for a lot of the most or the greatest American culture. I mean, music, art, dance, whatever. Chances are, if it didn't originate in the South, it was influenced by the South. And so we actually see the South as, you know, in some ways national and global. And, you know, that's the work that I'm really excited to be a part of. Wrecking's been around for a couple years now. And so we're kind of looking at sort of the next phase of what Wrecking is, what it can be, and what it should be.
Yeah, absolutely. I just came onto the team in November, right before the pandemic shift happened, and so it's been a very interesting journey, and I'm thankful to work with such a creative team. And now that we have Ryan here, we've been able to make some really strong strides ahead. And again, Reckon is being built as a platform. It's being built very specifically in targeting a very specific demographic of people that share a kind of shared ideology around being different, thinking different, wanting to see things that are not being provided on a mainstream platform, going into these different areas that don't get the exposure and talking to people who don't get the acknowledgement that they deserve. And so we have some really talented journalists that'll be covering different topics as we move forward. We have several different series that'll be rolling out, including this one. So that's just generally briefly about Reckon. We'll probably touch back in on it before we wrap up. But Ryan, before you just recently moved to Birmingham, but before moving to Birmingham, I think you also think you had like an unofficial case of COVID, right?
Yeah.
What was that like? How'd you figure out that? What made you think you had it?
Yeah, black with COVID with a asterisk. So yeah, I was traveling in February. I went to a conference and came back and was sick as a dog. It was a time when I think it wasn't long after like the first U.S. case had been reported in Seattle or DC, but they weren't doing wide testing at that point, and really still telling people that like, oh, in case you've been to these hotspots, you probably don't need to get tested. But yeah, I got off a plane and was like coughing my lungs out. It was a cold night, but I got home and I couldn't get warm. Like I got into bed under all my covers with all my clothes on, and couldn't get warm. I know I had a fever. I woke up that night just, even though I was freezing cold, drenched in sweat. My body hurt. My eye sockets were aching. I had no appetite except for oranges. Like oranges were like the only thing I could eat. It wasn't that I was nauseous. I just didn't have an appetite, and dehydrated. And so like I knew that it was not like any other like thing that I'd ever experienced with like a cold or a flu. And it was probably, I don't know, maybe a week into my symptoms that, it really kind of spread, and they were like, oh, if you have a fever, you might want to go get tested. But at that point, I wasn't sure that I wasn't sure that like I would test positive if I went to get a test. And besides, I mean, where I lived in Mississippi, it was, kind of out of the way, very remote. I was, fortunate enough to be stocked up on supplies. And so like, I knew I wasn't going to be going anywhere to interact with folks anyway, except for my roommate, which, another story. But, at that point, there was only so much I could do about it in terms of knowing that I had COVID. And so to this day, I'm pretty sure that's what it was. I mean, that does not mean like I'm not out here wilding without masks or anything like that. Like I'm being very, careful. We have mask mandates here in Birmingham. I got the hand sanitizer in my car, and I'm, trying to stay put as much as possible because like I don't know, but I'm pretty sure that's what I was going through.
And that was how long ago now? That's probably about a couple months, right?
Yeah, it was late February.
Okay. Yeah, I think we're seeing a lot of people that are essentially, in that same position that they're having the symptoms, and it's just like, what's the point of going and getting tested? If I think I have it, let me go ahead and treat myself like I have it, quarantine, go through the motions. But essentially, I think, one interesting thing is the talk of transmission after you test negative. And so that was one of the things that the nurses at the testing site told me was even after you test negative, and also several physicians in my family as well that told me this, that even after you test negative, that there is a period of time that you can still transmit the virus. You can still shed it. I think I call it shedding. And so I think it's important to still want to encourage people, if you do have symptoms, please go get tested. Obviously, Ryan was in a situation where they weren't testing yet, and it was a lot less accessible. But there are a lot of testing locations where you can get tested now. Be sure to go get tested, do your research, understand what you need to do. One thing I was going to talk about this week was like mental health involved with not only like quarantine and social isolation, but the mental health strain that happens with people that are contracting the virus. For me, it took like 3 weeks out of like my life of being able to see my daughter, probably 3 weeks and then some change, and it took a toll on me personally. And I'm going to talk with some more mental health experts about things that we can do to exercise our mental health during quarantine and social isolation. But wanted to, for you to speak on that perspective for you, because I think you battled some of that as well during the process.
Yeah, I mean, like you said, a lot of people, a lot of people don't have the luxury of bunkering down for 14 days. I mean, there are folks who are essential workers who have to go to work because they're essential workers, but like they also, need that paycheck. They need to make rent. Mm-hmm. There are folks who, live in homes with their families. There are folks who are caretakers for, loved ones who have to navigate all that. I mean, I think in terms of mental health for me, like the biggest thing was like fear of not knowing. Mm-hmm. I mean, I was pretty confident that I had COVID, but what I wasn't sure about was, all the questions around immunity. But then also I did a lot of reading on, sort of the interplay between COVID and like other things. So like the thing that I was worried about was like we were still in the middle of flu season. Mm-hmm. And so I'm like, okay, like I got really sick. I don't know that I had COVID, but like, what if I get the flu? Mm-hmm. And there's some sort of like complication because, I've read all this stuff about lung damage and heart damage. And so like, what if I have some internal damage from COVID and something else happens to me? Like, I'm not going to be a priority as far as the healthcare system is concerned because I'm not an active COVID patient. Mm-hmm. Or I mean, I don't know that to be true, but like that was my fear.
Yeah.
Kind of like the fear that people have of like getting in a car accident and needing to go to a hospital. Yeah. Or like needing a ventilator. I'm thinking like if I get sick again, if you can contract COVID again, like, do I get a ventilator because I'm not seen as a priority. And then I think the other piece of it is just the thing that I think that we're all sort of struggling through, whether or not, you have had experiences with COVID or not, is just like how to live in this moment, how to navigate all this stuff. Because like, I am somebody who's fortunate enough to, have a position where I can work from home, but, we talk about like the mental health challenges involved with, with working from home.
Yeah. I mean, we even saw like, last week, Officer Harry Wills with Birmingham Police Department, he contracted it, he's a father of 4, and he's an essential worker. He's a police officer. He has to go out in the field and engage with citizens on a daily basis. And so, I can imagine the dichotomy between, one needing to protect your family, but then also needing to feed your family, and the intersection of those two, I can imagine, like you said, we're both, blessed to be able to work from home. I think we've been working from home like 4 months now. And so we've, the workspace is really adapted. We've gotten used to the Zoom calls and we've made them entertaining and,
getting used to that.
we put it in together mode and then have the class. So but again, that's a privilege, and that's it's a thing I think a lot of us need to acknowledge and not take for granted, because there's a large majority of people who don't have that ability. They have to go out here and even if something as small as like keeping your mask on going in the store, I might sneak a breath in sometimes if no one's around, but ultimately, I mean, it's just not worth it to not take these steps to try to prevent it and keep it contained as much as we can. I've done a good bit of traveling actually, and see in a lot of different areas it's either widely accepted or widely rejected, and obviously we're dealing with this in America mostly. We're seeing how America is treating this a lot differently than other countries. I mean, we look at New Zealand and like Canada, they're not playing with these mask ordinances. They're not playing with social distancing. But America,
our rugged individualism here in America.
Yeah. And it's on display, and so it's very interesting. Okay, we have a couple of comments in here. This is absolutely awesome. Thanks for sharing. Thank you, Rob. Big ups to Rob. Rosalind, this is amazing. Thank you for your work. Thank you, Rosalind.
All directed at you, by the way.
She was talking to you. What's up, Harry? We got Officer Harry tuning in.
Okay, Officer Harry, I see you.
Have to remember safety and health first. Yeah, I'll be talking back to a few other officers here in the near future. Because that's just got to be a tricky situation to be in, having to do your job, but also protect yourself and still go home at the end of the night. My child's grandmother is a physician at Grandview, and one of the things she does when she comes home, she doesn't even come inside the house. She just puts her clothes immediately in the washing machine and showers, before even interacting with the baby. So I know a lot of people are having to take like those precautions before getting back into the house. Rob commented again. People need to wear a damn mask. I live in Alabama and I don't see people wearing masks. Bless both of you. You're awesome. Keep doing this, please. Rob, we really appreciate you, man. And keep tuning in. And yeah, I mean, people just need to wear the mask. I've actually had to like pull my t-shirt up because I left the mask at home one time. So, I've had to pull one of these, but
yeah. And I mean, it's so ridiculous that the wearing masks became so politicized. Like you were some sort of like weak-willed lib if you wore a mask. And so that's ridiculous. But I mean, for even people who feel that way, right? It's like you don't have a problem complying with like any other law, right? Like, if you get caught driving without a seatbelt or texting while driving, like you're going to get a ticket.
Right.
Like, we can talk all day about like whether or not it's fair or whether or not, police shouldn't be, focusing on real crime or whatever. But it's just like, folks want to talk about like people need to follow the law no matter what, because it is the law. Then, like these mask mandates, like they the law now. And so, we need to get on board with it. And yeah, I mean, I've lived in places where government officials like didn't want to impose wide mandates on people wearing masks and taking other safety precautions. And like some of those places are now hotspots. It's not, I'm not a doctor, but I know that it's not brain surgery.
Yeah, this was a really interesting graphic I came across the other day to kind of put some of this in perspective. As an American, you have a right not to wear a mask, but just like you, businesses have a right to not let you in. You can't have it both ways. You're free to make a choice, but that means accepting the consequences of your actions. don't mistake inconvenience for oppression. I think that's the driving line here is being told to wear a mask and having to deal with the consequences of a business deciding to not let unmasked patrons in their business. Your same freedom to exercise you not wanting to wear a mask is the same freedom that this business has to deny your patronage. And so I think that's something that's important that is not really being discussed in this ideology behind the rebellion of not wearing a mask.
Yeah, like nobody goes to McDonald's and sees that sign, no shoes, no shirt, no service. And it's just like, what? I'm in America.
No shoes.
Walking to McDonald's shirtless if I want to. Like we know that's inappropriate. Come on.
I can't wear a jersey to Nikki's West. I got kicked out for a basketball jersey on. So it's like, all right, you gotta have a shirt, you gotta have a t-shirt on. So
I mean, that's bullshit too, but
it's a family establishment,
But like,
I want my man arms out.
I'm not going to pitch a fit over it. I'm not going to get the law enforcement involved because someone's trying to make me comply with a dress code. Like,
people are real dude screaming and fighting employees at these businesses because they're not serving them for not wearing a damn mask. I mean, you're not going to suffocate and die. And you're literally only ordering long enough to get your food and sit down. I mean, most places you just have to wear the mask until you go sit down, which is an interesting, scenario anyway. You just have to wear the mask to get inside, and then when you're seated, you can take it off. And if you have to walk around, they ask you to put it back on. So I mean, I think they're being as flexible as possible, but like you said, if they're going to mandate it and make it a law, then we just need to deal with it.
I mean, I think it really speaks to the this idea of who is like most impacted by the disease.
Mm-hmm.
I see a lot of conversations on social media, folks who are like, well, I don't know a single person,
mm-hmm.
Who has died from it. Well, we know who's dying from it, and it's disproportionately Black folks, Latinx folks of color in general. Oh, got the graphic already.
Got it ready.
Already there. And so, I mean, I think that sort of speaks to, a lot of social disconnects that people have because, they're not personally affected by something. It's not real. But, I remember, in the very early days when reports about deaths first started coming out, it was like, someone in Chicago, somebody in St. Louis, and like they were all like Black working class people. Mm-hmm. And so like we knew.
Yeah.
Because when America catches a cold, whether it's, a literal pandemic or some sort of economic collapse, the folks who are most vulnerable because they have less access, to support systems, are going to be the most impacted. And so like, that's always going to be Black people. It's always going to be Latinx people. It's always going to be poor folks. And so, yeah, I mean, I think I hope that is starting to change.
Yeah.
For people in large part, just because, I don't know, maybe people are resigned, they've given up the whole mask fight. And so at the very least, they know if they want to go to the bar, they got to take that mask with them.
Yeah, I mean, we're seeing it. We're seeing on both sides. We're seeing like the rebellion and kind of, like you said, cognitive dissonance from communities that are not being primarily affected, through the virus, but also, we're still seeing our own communities like still packing out clubs and, just going on with regular daily life without making these, any type of, preventative measures. So I've seen it both ways. It's a disconnect, both a tangible and intangible disconnect. People who do have people in their family who are being affected are still not, taking the right steps. They're still going out. And I think that just speaks to like one, our some of our privilege as Americans, but also something deeper around the need for like human interaction more than we kind of thought we needed. And I think that's something that's important that we're going to end up finding more about, during this time, is how important human interaction is needed from person to person, and how this adaptation has caused some different dependencies almost. People are like, I have to get out of the house. I need to be around people. And for a lot of people, that they've never really had those emotions come to the forefront before. So I'm seeing it a lot of different ways, but like you said, I mean, I think the care shift happened when the demographic data started coming out.
Yeah, for sure.
The sentiment started.
Remember when it was the great equalizer? It was like COVID knows no color, and then we found out that Black people were dying disproportionately, and it was
at first, Black folks thought we couldn't get it.
There was a lot of that. I mean, there's a lot of
that. The very first thing was like, all right, Black folks can't get this because we don't see any Black people dying from it yet. And then almost like a week later, it started slamming.
Yeah, and I mean, there's even stuff like in Latinx communities that was sort of I mean, there were myths, right? It was like, oh, well, like if you clean your kitchen like this specific way, then like you'll be immune, and it was just like it was deeper than that. Mm-hmm. And so like I know a lot of people, some news organization got really smart about creating sort of audience specific tools, looking at like specific myths, like, oh, if you drink like this kind of kombucha, like you'll be immune. And it's just like, there's like the fact that like we want to be healthy, and like having healthy bodies and immune systems like will be better if you get it. That's a separate thing from like we need to be smart about how to protect ourselves and our folks from this thing, because one of the things that I think gets lost in the conversation, when we see these pictures, like you said, of like packed out clubs and like people at these massive pool parties, and conversation online will be like, well, they're going to be sorry when they get sick. Like whether or not those people get sick, I mean, like that would be a tragedy. But like think about like the gas station that those people stopped at along the way, to pick up a 24 pack of Natty Light, and exposing those people who were there because they have to be there, mm-hmm. Because they're essential workers. And so, I mean, it may be true that younger people, have stronger resistance, and like young people may feel that they're invincible and like that's why they're out there. But I'm thinking about like all the people who don't have that choice that they might interact with, and like that's the real danger. Mm-hmm. Right? Because like if you are an essential worker, like at a convenience store, right? Like you probably don't have company provided health insurance.
Yeah.
You might get a free test, but if you get sick, like who's going to pay your doctor bill? Mm-hmm. Right? And so like I think those are the people that we should center more in these conversations, more so than, I mean, the behavior is not the behavior that people should be engaging in. But there's that, but then there's also like what happens after they leave the club or the pool party and go somewhere else.
Yeah, absolutely. And I mean, that goes back to, what I was saying about transmission, even after you're negative technically on the test, you're still able to transmit the virus. And so it's just important. We have to keep this up until we're able to curb it somehow. OG Rob had another comment. I did some work with the Lakota Indians in South Dakota. Any idea of how this is hitting Native American groups? Yeah, Rob, this is actually hitting, essentially people of color in America the hardest. And so I can pull this data back up. This is up-to-date data You can find it at the COVID tracker, covidtracking.com. And so this is data that is pulled from the Boston University Center for Anti-Racist Research. And they're comparing it and contrasting it with census data. And so states where race is being reported in addition to the deaths, this is what we're seeing. And on this third line here, you can see Native Americans being affected, deaths per 100,000. They are right third in line. So the differentiation has essentially been people of color. So that, and again, black is a very broad statement. Black is brown and all of these colors combined. And so this is what the data is showing. And again, there are different, there's no definitive reason of why there are a few different theories. But essentially, kind of common sense will tell you that access to healthcare, treatment in healthcare, the ability to, Dr. Fauci made a very important statement that, a large majority of Black and brown folks in these categories are essential workers. They don't have the ability to work at home and in social distance. And so they're being forced into exposure and transmission of the virus at a kind of in an unavoidable way. And so that's what we're seeing. So in the future, I'll look to speak with some representatives. I'll look to speak with some representatives from the Latinx and Native American communities to see how they are adapting to changes from the pandemic and what they're doing to help curb the virus in their communities as well.
Yeah, I mean, any community you can think of that is disproportionately experiences poverty, that has disproportionate negative health outcomes, mm-hmm. is going to be disproportionately affected by this disease. Mm-hmm. And that's, certainly true of Black and Latinx folks, and indigenous people.
And one thing I was going to say too, and we're going to wrap up here pretty soon. But, also the hesitancy of getting tested, of going through the healthcare system as a whole, Black and brown folks in America have some fairly justified reasons for having some apprehensions about trusting the healthcare system. Even if we obviously have the primary example of the Tuskegee experiments, but historically we've seen that Black folks, especially, but Black and brown folks have been essentially experimented with in the healthcare system, and so we have some lingering trauma that exists that could contribute to our hesitancy and apprehension in trusting the healthcare system. Obviously, the talk of the vaccines is out, and I ain't gonna take the vaccine, and what's your take on that?
Yeah, I mean, I don't even know if it's linger. I mean, look at all the stories that we know about the experience Black women have with the medical industry, and physicians who ignore their when they're in pain and tell them they don't need certain tests run as an ambulance drives by, and so I mean we are living that, and so I mean it's not unjustified or irrational that Black people have these trepidations when it comes to dealing with the healthcare system. Now, I mean, a lot of that we need to work through. We need to encourage folks, to go to the doctor when they're sick, and we need folks. We need to, sort of deconstruct that stigma around mental health. And it's not just he just crazy. Ain't nothing wrong. It's just yeah, maybe they need to talk to somebody. Maybe they need to talk to a professional. I think that younger folks are better about sort of understanding these things, and hopefully like they will be sort of the ambassadors within our community for better health decisions all around.
For sure. Hey, well, Ryan, I appreciate you taking the time out. I'll definitely have you back on here soon. Thank you, everyone, for tuning in. We're doing this every Monday at 11 a.m. right here on Reckon. Ryan, thank you for coming in. Thank you for being on the team.
Yeah, thanks.
Please stay tuned in to Reckon. Again, follow us. The new website is reckonsouth.com. You can follow our Facebook, Instagram. Instagram is Reckon South. We'll be dropping some really cool stuff here in the near future. So please follow, subscribe, like, comment, share, all the above. And we'll see you guys next week.